Hello and welcome. My name is Dominic Tavares, and in this short video, I'm going to be emphasizing the main points of eating for a heart-healthy diet. So first, I just want to go over what a heart-healthy diet is, and that is a diet that contains low sodium, so anything under the dietary guidelines for the average day, which is around 2,300 milligrams. A diet that has low added sugar, so that means you're not going to be drinking very much soda or lemonade or anything really sweet like that. A diet that has low saturated fat, so you're not going to be eating a lot of really fatty meats and things like that, and just trying to emphasize as much fiber as you can in your diet. So first, I want to go over saturated fat. So on the left, we have some food choices that have a lot of saturated fat in them, like pork chops, sausage, bacon, butter, pretty much any fat that is solid at room temperature. And on the right, I put a nutrition facts label with the saturated fat portion of the label highlighted, so you can easily see where to look on the back of a menu or a food product to see where the saturated fat is to find out how much you're eating. And I just want to highlight that the American Heart Association recommends that no more than 7% of your daily calories come from saturated fat. So to put that in perspective, if you're eating around 2,000 calories a day, that's about 16 grams of saturated fat a day. So you should aim to keep your saturated fat intake under 16 grams a day. And doing this will help to lower your cholesterol levels. Saturated fat has been shown to increase LDL cholesterol, which is the bad cholesterol, and you definitely don't want that to happen because that leads to an increased risk of cardiovascular disease. So next, we're going to go over added sugar. Added sugar is commonly found in carbonated beverages like Coke or Pepsi, and a lot of sweetened drinks like lemonade or iced tea. So a couple ways to avoid added sugar is to drink things like unsweetened tea, replace drinks like soda with just water. And if you look on the back of a nutrition facts label, it now has to show how many grams of added sugar are in the food or drink that you're consuming. And the American Dietary Guidelines recommends that no more than 10% of your daily calories come from added sugar. So if you're eating around 2,000 calories a day, that means no more than 50 grams of added sugar per day. And it's important to know that when you're looking at the back of a nutrition label, such as the one on the left, let's assume that it's chocolate milk. It'll say there's naturally occurring lactose in milk, which will show as sugar on the back of the menu. But it's important to only include the added sugar in your dietary guidelines for the day. So if you drink this beverage on the left, that means you should consume less than 40 more grams of sugar that day. And sugars that come from fruit and vegetables don't count towards your added sugar for the day because those are naturally occurring. Next, we have high sodium. You don't want to be eating a high sodium diet as it can lead to many poor side effects such as high blood sugar, high blood pressure. You can suffer from stroke and vision loss. It is recommended that by the dietary guideline for Americans that you consume under 2,300 milligrams of sodium per day if you have normal blood pressure levels, and under 1,500 milligrams a day if you have high blood pressure. So on the left, I highlighted the nutrition fact label where sodium can be found, so it can be easily distinguished between all of the other ingredients. Next, I want to talk about a food that you should emphasize in your diet, and that is soluble fiber. This is because consumption of soluble fiber has been shown to help lower cholesterol. And the reason that the Honey Nut Cheerios or the brand in general is allowed to say that they can help lower cholesterol is because there's oats in Honey Nut Cheerios, and oats have soluble fiber in them. So when they're saying that it can help you lower cholesterol, they are telling you the truth. And on the left, again, I highlighted where on the nutrition facts you'd be able to find soluble fiber. So some good sources of soluble fiber are oats, sweet potatoes, yams, and barley. Anything that can, like fruits and vegetables, also have a lot of fiber in them. So transitioning to fruits and vegetables, a lot of fruits and vegetables such as bananas and potatoes and oranges have potassium in them, which will, if you're reducing the amount of sodium in your diet, will kind of work as like a double whammy to help reduce blood pressure. And there's a lot of naturally occurring antioxidants, vitamins, and minerals in fruits and vegetables that are very important for your diet. So I just wanted to drive home a couple things before this video ended. If you're trying to follow a heart healthy diet, you should work to reduce your sodium intake, also reduce your added sugar intake. Reducing your saturated fat consumption will help lower cholesterol. Increasing your soluble fiber intake will also help lower cholesterol. And increasing fruit and vegetable intake will help for overall health and longevity.